If you got a question for the ER doctor, we have an ER doctor here. So today we're asking you about bronchitis.
Yeah, you know, this is a topic of discussion. We're seeing it a lot in the headlines. The Pope is currently hospitalized for bronchitis. He has his own risk factors. He's over the age of 80. He has a history of only an isolated or one lung. He had one lung removed, and he's currently being treated, as far as we know, from the Vatican, the most recent update, for a polymicrobial infection, which typically means that he's likely suffering from more than one type of infection, for example, a bacterial and a fungal infection. Now, the question that patients ask is, what is bronchitis and how is it different from pneumonia? It's really just dependent on where the infection is in the lung. For example, if it's in the air sacs, the area that we breathe and we take in air, that's a pneumonia. Where if it's in the tubes that supply our air sacs, that is bronchitis.
Oh, interesting. Yes, you can have bronchitis and pneumonia at the same time, I've learned.
Unfortunately, you can. And sometimes many patients, especially during the flu season, can have a viral pneumonia, and then that decreases your immune response to protect you against other organisms, and then that can lead to a bacterial pneumonia. So if your cough after the flu, for example, is lasting longer than 3 weeks, you might want to get an x-ray or get examined.
And that's a little scary for him because 88 years old, right?
Yeah.
I mean, at the end of the day, he's still 88.
It's still 88 and it's a risk factor. So what can you do if you're being an advocate, taking your relative who might be older into the hospital? I think looking at the symptoms or looking at the numbers the same way that I look at them as a physician. And I explain this to my patients. If their oxygen is low, if they're breathing fast, if their blood pressure is low, if they're not acting normally, these are usually indicators to keep a patient in the hospital. And one thing you can ask for is ask that parent or that relative to walk around while connected to oxygen or an oxygen monitor to see how their numbers are doing. That helps you to understand how they'll do at home.
And you said 3 weeks if it doesn't go away in 3 weeks.
Typically, a cough lasts about 3 weeks. Many people don't know that, and so if it's longer than that, you want to get examined.